adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 65: Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy: topical salicylic acid used in small amounts and limited areas, large-scale systemic absorption possible though typically minimal, topical azelaic acid, generally considered safe, topical clindamycin, some. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 63. Acne in patients with liver disease and metabolic disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. The insulin resistance driving metabolic syndrome increases androgens and sebum production, worsening acne. Managing metabolic syndrome through weight loss, exercise, and dietary changes often improves acne. PCOS involves insulin resistance and is therefore associated with metabolic syndrome and worse acne. Managing PCOS-related acne involves addressing insulin resistance through diet, exercise, and potentially medications like metformin. Diabetes, particularly poorly controlled diabetes, worsens acne through multiple mechanisms: inflammation, immune dysfunction, altered wound healing. Optimizing diabetes control improves acne. Liver metabolizing medications used for acne, like spironolactone, oral antibiotics, require dose adjustment in liver disease and monitoring for side effects. Patients with liver disease should have liver-specific dosing guidance from their healthcare providers. Hepatotoxic medications, like isotretinoin, which requires liver monitoring even in healthy individuals, should be used cautiously or avoided in patients with liver disease. Baseline liver function testing and monitoring are essential if used. Weight loss, if overweight, provides multiple benefits including acne improvement through metabolic and hormonal mechanisms. Lifestyle interventions addressing metabolic health support both acne management and overall health. Guide 64. Acne in patients with polycystic ovary syndrome, PCOS, comprehensive management. PCOS is a common hormonal disorder strongly associated with acne. Understanding PCOS-specific acne management optimizes outcomes for affected individuals. PCOS involves androgen excess, ovulatory dysfunction, and typically insulin resistance. These factors combine to cause often severe acne, frequently concentrated on the lower face and jawline. Hormonal testing for PCOS includes elevated androgens, elevated LH with normal or low FSH, and often elevated fasting insulin and insulin resistance markers. Pelvic ultrasound might show polycystic appearing ovaries. Acne in PCOS often differs from typical hormonal acne in severity and resistance to standard treatments. Many PCOS patients with acne require systemic hormonal treatment for adequate control. Birth control pills are first-line hormonal treatment for PCOS acne, with formulations containing low androgenic progestins preferred. Typical acne improvement occurs within 3 to 6 months. Spironolactone provides additional androgen reduction when combined with hormonal contraceptives. The combination often provides better acne control than either alone. Metformin, while primarily treating insulin resistance, can modestly improve acne by improving metabolic parameters and potentially reducing androgens. Typical dosing is 1,000 to 2,000 mg daily. Lifestyle interventions are particularly important in PCOS. Weight loss, even if overweight, or weight management if normal weight, improves insulin sensitivity and androgen levels, often improving acne significantly. Exercise, particularly resistance training, improves insulin sensitivity. Dietary modifications emphasizing low glycemic foods support metabolic health. Comprehensive PCOS acne management combines hormonal contraceptives, spironolactone if needed, metformin if insulin resistant, lifestyle optimization, topical acne treatments, and potentially professional treatments. This multifaceted approach addresses both the underlying PCOS pathophysiology and surface acne manifestations. Many women with PCOS achieve significant acne improvement through this comprehensive approach, even if acne was previously treatment-resistant. The key is addressing underlying PCOS rather than only treating surface acne. Guide 65: Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66: Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk. Apply sunscreen after benzoyl peroxide and wait a few minutes before reapplying other products. Generally, sunscreen should be your final skincare step before makeup. If you develop a sunburn despite sunscreen use, cool compresses, hydration, and soothing products like aloe vera help. Avoid further sun exposure until healed. Severe sunburns are dangerous and should be treated seriously. However, if you're using appropriate sunscreen correctly and minimizing peak sun exposure, severe sunburns should be rare. Guide 12. Treating post-inflammatory hyperpigmentation and acne scarring. After acne heals, two primary complications can persist: post-inflammatory hyperpigmentation, dark marks, and physical scarring. Understanding these conditions and the various treatment approaches available is essential for achieving truly clear skin, not just clear of active acne but also free from acne's lasting marks. Post-inflammatory hyperpigmentation, PIH, appears as flat, dark patches or spots where acne was previously present. These marks result from inflammation triggering excess melanin production in healing skin. PIH is particularly common in individuals with darker skin tones and in areas that received more inflammation or trauma. Unlike active acne, PIH doesn't involve bacteria or require acne-specific treatments. It requires treatments targeting melanin and pigmentation. Understanding PIH timeline is important for realistic expectations. Most PIH gradually fades naturally over 6 to 12 months with consistent sun protection, even without treatment. However, this timeline can feel unacceptably long, motivating people to pursue active treatments. The good news is that numerous treatments significantly accelerate PIH fading. Sunscreen is the foundational PIH treatment. UV exposure directly darkens hyperpigmentation, extending the timeline for natural fading. Using SPF 30+ daily and avoiding sun exposure accelerates PIH resolution dramatically. Some PIH that might take 12 months to fade with poor sun protection might fade within 3 to 4 months with strict sun protection. Vitamin C serums brighten hyperpigmentation and even skin tone. L-ascorbic acid at 15 to 20% concentration is most effective, though magnesium ascorbyl phosphate and other stabilized forms also work. Apply vitamin C serum daily in the morning before sunscreen. Results typically appear after 4 to 8 weeks of consistent use. Vitamin C also provides antioxidant protection and stimulates collagen production as a bonus benefit. Niacinamide reduces post-inflammatory redness and even skin tone. At 4 to 5% concentration in moisturizers or serums, applied daily, niacinamide shows improvements in PIH within 4 to 8 weeks. Niacinamide is gentle, suitable for even very sensitive skin, and works well in combination with other treatments. Azelaic acid is particularly effective for PIH. At 15 to 20% concentration, applied twice daily, azelaic acid reduces melanin production and even skin tone. Prescription azelaic acid, Azalex, Phenacea, is more potent than over-the-counter versions. Many dermatologists recommend azelaic acid specifically for PIH management. Results typically appear within 4 to 8 weeks. Kojic acid inhibits melanin production. Available in serums and creams at 1 to 2% concentration, applied daily, kojic acid gradually lightens hyperpigmentation. Results take 4 to 8 weeks of consistent use. Kojic acid is generally well tolerated but can cause mild irritation in some individuals. Hydroquinone is a prescription bleaching agent highly effective for hyperpigmentation. It directly inhibits melanin production. Prescription hydroquinone typically ranges from 2 to 4% strength, applied twice daily to affected areas. Results appear within 4 to 12 weeks. However, hydroquinone should not be used continuously for more than 3 to 4 months without medical supervision, as extended use can cause paradoxical darkening or an uncommon condition called ochronosis. Hydroquinone is not suitable for everyone and requires dermatologist prescription and monitoring. Chemical peels accelerate PIH resolution. Superficial peels with glycolic acid or salicylic acid remove pigmented surface skin, revealing lighter skin underneath. Monthly superficial peels combined with daily topical treatments significantly accelerate PIH fading. Medium-depth peels provide more dramatic but riskier results and are typically only performed for severe PIH. Laser treatments effectively target hyperpigmentation. Q-switched lasers are specifically designed to break up melanin pigment, with different wavelengths targeting different pigment depths. These treatments provide results in 4 to 6 sessions, sometimes fewer for responsive PIH. However, laser treatment is expensive and carries risks of complications in darker skin types. IPL, intense pulsed light, therapy also addresses pigmentation effectively. Microdermabrasion physically removes pigmented surface skin through mechanical abrasion. Performed monthly, combined with topical treatments, it accelerates PIH resolution. However, it's less powerful than laser treatments and typically requires more sessions. Combination approaches yield best results. Most dermatologists recommend combining daily topical treatments, vitamin C, azelaic acid, or hydroquinone, with monthly professional treatments, chemical peels or laser. This dual approach treats PIH from multiple angles, achieving faster, more complete resolution. Acne scarring is a more permanent complication than PIH. Scarring results from significant inflammation destroying collagen, resulting in physical indentations or elevation of the skin. There are 3 main types of acne scars: ice pick scars, deep, narrow indentations; boxcar scars, wider, flat-bottomed indentations; and rolling scars, wave-like depressions. Prevention is the most effective scar treatment. Avoiding picking, squeezing, or extracting pimples prevents scarring. Treating acne aggressively prevents deep inflammation that causes scarring. Taking acne seriously and treating it promptly prevents severe scarring. For existing scars, multiple treatment options exist. Though complete elimination is often impossible, the goal is significant improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural damage that topical products can't reverse. However, improving overall skin texture and treating associated hyperpigmentation can make scars less noticeable. Subcision is a minor surgical procedure where a needle is inserted under the scar, breaking the fibrous tissue causing the depression. This allows collagen to regenerate and fill the scar. Subcision works best for rolling scars and tethered scars. Results appear gradually over 6 to 12 months as new collagen forms. Laser resurfacing removes thin layers of skin, smoothing scars. Fractional laser resurfacing is less aggressive than full resurfacing and requires less downtime. Multiple treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods. For example, establish stable benzoyl peroxide use for 4 weeks before adding salicylic acid to your routine. Use complementary treatments on different parts of your routine when possible. For example, use salicylic acid cleanser in the morning, brief contact, mild treatment, and benzoyl peroxide leave-on at night, extended contact, potentially more irritating. This separation minimizes cumulative irritation. Monitor for excessive irritation. If combining treatments causes significant redness, dryness, peeling, or sensitivity beyond what either treatment alone causes, reduce frequency of one or both treatments. You can use both treatments but at lower frequencies, for example, benzoyl peroxide once daily instead of twice daily, or salicylic acid 2 to 3 times weekly instead of daily. The sandwich method reduces irritation when combining treatments. Apply your first treatment, perhaps benzoyl peroxide, wait 20 minutes, apply moisturizer, then apply your second treatment, perhaps retinoid. This dilutes treatment somewhat and reduces irritation while maintaining efficacy. Some combinations should be avoided or approached cautiously. Vitamin C and benzoyl peroxide together can reduce vitamin C effectiveness, so apply these at different times. Retinoids and strong chemical exfoliants used on the same evening can cause excessive irritation. Separate these if combining. Benzoyl peroxide with niacinamide is generally fine, though separating them, benzoyl peroxide at night, niacinamide in morning moisturizer, is easier. Assessment of combination therapy effectiveness requires patience. Most people need 8 to 12 weeks of consistent combination therapy to determine if it's working well. Acne doesn't improve overnight. Allow adequate time for evaluation. Adjusting combinations based on response is important. If one component seems essential while another isn't providing obvious benefit, you might discontinue the less beneficial component. Conversely, if you're experiencing insufficient improvement, you might increase one component's frequency or concentration, or add an additional treatment, perhaps adding retinoid to an existing benzoyl peroxide and salicylic acid combination. Professional guidance is valuable when considering combination therapy for severe acne. Your dermatologist can recommend appropriate combinations, warn about potential interactions, and guide introduction sequencing. Don't hesitate to discuss combination therapy approaches with your dermatologist. Guide 24, Understanding and Managing Fungal Acne, Malassezia folliculitis. Fungal acne, more accurately called Malassezia folliculitis or Pityrosporum folliculitis, is often misdiagnosed as bacterial acne. This condition presents similarly to acne but results from yeast overgrowth rather than bacterial infection, requiring different treatment approaches. Understanding this condition prevents prolonged ineffective treatment with standard acne medications. Malassezia is a naturally occurring yeast on human skin. In most people, it colonizes skin without causing problems. However, in some individuals, conditions favor Malassezia overgrowth, leading to follicle inflammation and fungal acne appearance. Unlike bacterial acne caused by Cutibacterium acnes, fungal acne results from yeast proliferation. Fungal acne typically appears as uniform, small pustules, often in clusters on the back, chest, and shoulders, though facial fungal acne occurs. The pustules are often quite uniform in size and appearance, less variable than typical bacterial acne. Fungal acne is often very itchy or uncomfortable, more so than typical acne. It often appears or worsens after antibiotic courses, as antibiotic elimination of competing bacteria allows Malassezia to proliferate unopposed. Several factors promote Malassezia overgrowth. Warm, humid environments favor yeast growth, explaining why fungal acne often worsens in summer or in humid climates. Excessive sweating creates favorable conditions. Wearing tight, non-breathable clothing traps moisture and heat, promoting yeast overgrowth. Immunosuppression or diabetes can promote yeast overgrowth. Recent antibiotic courses allow Malassezia to proliferate. Oil-based products and heavy moisturizers can promote yeast growth in susceptible individuals. Diagnosing fungal acne requires suspicion. If your acne doesn't respond to standard acne treatments, doesn't respond to antibiotics, or started after antibiotics, fungal acne is possible. Your dermatologist can perform a KOH, potassium hydroxide, preparation or fungal culture to confirm Malassezia, though clinical diagnosis is often sufficient. Standard bacterial acne treatments are ineffective for fungal acne because they don't address yeast. Benzoyl peroxide and salicylic acid have minimal effect on Malassezia. Antibiotics don't treat yeast. Retinoids don't specifically treat yeast. Using these treatments on fungal acne can be frustrating. You follow a good acne regimen but see no improvement because the underlying cause isn't bacterial. Topical antifungals effectively treat fungal acne. Ketoconazole, available in shampoos and creams, kills Malassezia. Apply 2% ketoconazole cream to affected areas daily. Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces Malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Guide 1. Complete understanding of acne, pathophysiology, types, and root causes. Acne is one of the most prevalent skin conditions affecting approximately 85% of people aged 12 to 24, with significant numbers also experiencing adult acne. To effectively treat acne, you must first understand its underlying mechanisms and various manifestations. Acne develops through a complex process involving 4 primary factors: increased sebum production, follicular hyperkeratinization, colonization by Cutibacterium acnes bacteria, and inflammation. The sebaceous glands, which produce sebum or skin oil, become hyperactive primarily due to hormonal stimulation. During puberty, androgens like testosterone trigger increased sebum production. This oil production is essential for skin protection, but excess sebum creates an environment conducive to acne development. The sebaceous glands have androgen receptors, meaning individuals with heightened sensitivity to hormones or with hormonal imbalances experience excessive sebum production. Follicular hyperkeratinization refers to the abnormal shedding of skin cells lining the hair follicle. Normally, dead skin cells shed and exit through the hair follicle to the skin surface. In acne-prone individuals, these cells stick together and don't shed properly, creating a plug within the follicle. This plug, combined with sebum, forms an ideal environment for bacterial growth and acne formation. Cutibacterium acnes, previously known as Propionibacterium acnes, is a naturally occurring bacterium on human skin. However, in the oxygen-poor environment created by plugged follicles, this bacterium proliferates rapidly. These bacteria produce enzymes and toxins that trigger the immune system, causing inflammation and the visible acne lesions you see on your skin. Inflammation is the final component and arguably the most visible aspect of acne. When the immune system responds to bacterial presence and follicle rupture, it sends inflammatory cells to the area, causing redness, swelling, heat, and the formation of pustules or nodules. Understanding this process is crucial because different acne treatments target different components of this mechanism. There are numerous acne types, each requiring different treatment approaches. Non-inflammatory acne includes blackheads and whiteheads. Blackheads, or open comedones, form when a follicle is clogged with sebum and dead skin cells, but the pore remains open. The dark appearance results from oxidation of the sebum, not dirt. Whiteheads, or closed comedones, occur when the follicle is completely sealed, trapping sebum and dead cells beneath the skin surface, creating a small white or flesh-colored bump. Inflammatory acne is more noticeable and potentially scarring. Papules are small, firm, red bumps without a visible center, representing the body's inflammatory response. Pustules are similar to papules but contain a visible yellow or white center filled with pus. These are the classic pimples most people recognize. Nodules are larger, deeper, solid lesions that develop when inflammation extends deeper into the skin. They're typically painful and can last for weeks. Cystic acne represents the most severe form, where large, fluid-filled lesions develop deep within the skin. These are extremely painful and highly prone to causing permanent scarring. Several factors contribute to acne development beyond just hormones and bacteria. Genetics play a significant role. If your parents had severe acne, you're more likely to experience it too. Environmental factors matter considerably. Living in humid climates can exacerbate acne due to increased moisture promoting bacterial growth. Pollution and environmental toxins can clog pores and trigger inflammation. Stress hormones like cortisol increase sebum production and inflammation, explaining why acne often worsens during stressful periods. Diet influences acne more than previously thought. High glycemic foods rapidly spike blood sugar, causing insulin surges that trigger sebaceous gland stimulation and androgen production. Dairy products, particularly skim milk, contain hormones and proteins that may trigger acne in susceptible individuals. Omega-3 fatty acid deficiency promotes inflammation, while excessive omega-6 consumption without sufficient omega-3s creates an inflammatory imbalance. Certain medications, including corticosteroids and lithium, are known to trigger or worsen acne as a side effect. Recognizing your specific acne type and identifying contributing factors is the first step toward effective treatment. Some people have purely hormonal acne, while others struggle with bacterial acne, dietary triggers, or environmentally influenced breakouts. Understanding your personal acne profile allows you to select treatments targeting your specific problem rather than wasting time and money on ineffective solutions. Guide 2: Comprehensive Daily Cleansing and Preparation Routine for Acne-Prone Skin. The foundation of any successful acne treatment regimen is an appropriate cleansing routine. Many people underestimate the importance of proper cleansing, believing that any soap will suffice. However, for acne-prone skin, the cleansing process is far more nuanced and critical to success. Your cleansing routine will prepare your skin for treatment products and remove substances that promote acne formation. Begin by understanding that you should cleanse your face twice daily, once in the morning and once at night. Morning cleansing removes the oil, dead skin cells, and bacteria that accumulate overnight while you sleep. Your skin is active at night, producing more sebum and shedding dead cells, so morning cleansing is not optional. Evening cleansing is equally important, removing makeup, environmental pollutants, dirt, excess oil, and dead skin cells accumulated throughout the day. Many people neglect evening cleansing or do it hastily, significantly compromising their acne treatment results. Temperature matters more than most people realize. Always use lukewarm water, never hot water. Hot water strips away your skin's natural oils and disrupts the skin barrier, leading to increased irritation and compensatory sebum overproduction. Excessively hot water also causes blood vessel dilation, temporarily increasing inflammation and making acne appear worse. Conversely, cold water doesn't effectively remove oil and impurities, leaving your skin inadequately cleansed. Selecting an appropriate cleanser is crucial. For acne-prone skin, choose a gentle, pH-balanced cleanser specifically formulated for this skin type. The pH of your skin is approximately 4.5 to 5.5, slightly acidic. Using alkaline soaps disrupts this pH balance, damaging your acid mantle and increasing sensitivity and bacterial overgrowth. Look for cleansers labeled pH balanced or for acne-prone skin. Many quality acne cleansers contain salicylic acid, a beta-hydroxy acid that penetrates into pores to dissolve sebum and dead skin cells. A concentration of 0.5% to 2% is appropriate for daily cleansing. Some people prefer cleansers with benzoyl peroxide, which kills acne-causing bacteria. A 2.5% benzoyl peroxide cleanser is effective without excessive drying when used in a cleansing format rather than as a leave-on treatment. Others prefer gentle, fragrance-free cleansers without active ingredients, particularly if their skin is sensitive or if they're using other strong acne treatments. Experiment to find what works best for your skin, understanding that what works for your friend may not work for you. The cleansing process itself requires attention to technique. Wet your face thoroughly with lukewarm water to open your pores slightly and soften your skin. Apply your cleanser using your fingertips or a soft washcloth. Using your hands is often preferable because you have better control and can feel whether you're applying too much pressure. Gently massage the cleanser into your skin using circular motions for approximately 30 to 45 seconds. This duration gives the cleanser time to dissolve oil and loosen impurities without overstripping your skin. Pay special attention to your T-zone, your forehead, nose, and chin, where sebum production is typically highest. However, don't neglect other areas, particularly your jawline and cheeks where hormonal acne often appears. Be especially gentle around your eyes and lips where skin is thinner and more sensitive. Never use a rough scrub or washcloth, as physical abrasion can irritate acne lesions, spread bacteria, and increase inflammation. After thoroughly massaging, rinse your face completely with lukewarm water. Ensure you remove all cleanser residue, as leftover cleanser can irritate your skin and interfere with the absorption of treatment products. Pat your face gently dry with a clean, soft towel. This is important. Never rub your face dry aggressively. Aggressive rubbing irritates inflamed acne, increases inflammation, and can spread bacteria to other areas of your face, stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98, Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N-of-1 Experimentation. N-of-1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N-of-1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N-of-1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches targeting multiple acne mechanisms simultaneously are increasingly recognized as optimal. Future standard treatment might involve coordinated multi-mechanism attacks on acne. Artificial intelligence continuing to improve might eventually enable excellent personalized treatment selection and monitoring. Understanding that acne science advances constantly provides hope. Treatments available today vastly exceed what existed 20 years ago. Future treatments will likely be even better. Your acne is treatable now with current treatments. However, if current treatment's insufficient, future advances might provide new options. Either way, clear skin is achievable. Starting with gentle treatments is appropriate for adolescents. Many teenagers' skin is quite resilient and tolerates strong treatments well, but starting conservatively establishes good habits. Teaching proper skincare techniques during adolescence establishes lifelong habits. Involving adolescents in treatment decisions increases compliance. Understanding why treatments are recommended, how to use them properly, and what results to expect improves adherence. Adolescents who feel involved in their treatment are more likely to stick with routines. Addressing acne myths prevalent among adolescents: chocolate causes acne, poor hygiene causes acne, etc., prevents reinforcing false beliefs and harmful behaviors. Professional dermatology involvement is appropriate even for moderate adolescent acne, as dermatologists can recommend appropriate treatments and monitor for complications like scarring. Discussing how acne affects emotional well-being opens conversations about mental health support if needed. If acne is causing depression or anxiety, professional mental health support should be offered. Realistic expectations help adolescents understand that acne improvement takes weeks to months, not days. Understanding this prevents discouragement. Guide 68: Acne in Older Adults, Age-Related Changes and Treatment Adjustments. Acne persisting into or developing in older adults has unique characteristics requiring age-specific management adjustments. Adult acne in those over 40 or 50 is often hormonally driven, particularly in women during perimenopause and menopause, and typically more inflammatory than comedonal compared to teenage acne. Aging skin is tap water or filtered tap water is typically adequate. Unless you have specific water quality concerns, tap water is fine. Some people promote alkaline water for acne, claiming it reduces inflammation. However, your stomach acid immediately neutralizes any pH changes from drinking alkaline water, so drinking alkaline water doesn't meaningfully change your body's pH or skin conditions. Alkaline water claims are largely marketing. Herbal teas and other beverages contribute to hydration alongside water. Coffee and other caffeinated beverages have mild diuretic effects but still contribute to daily hydration. However, excessive caffeine consumption can worsen acne through stress and inflammation, so while counting toward hydration, caffeinated beverages shouldn't dominate your fluid intake. Hydration from food contributes to overall hydration. Fruits and vegetables contain significant water. Eating water-rich foods like watermelon, cucumber, lettuce, and citrus fruits contributes to hydration alongside drinking water. Relationship between hydration and acne typically takes 2 to 4 weeks to manifest. Improving hydration from dehydrated state to properly hydrated state might improve acne noticeably. However, increasing hydration beyond adequate amounts typically doesn't further improve acne. The practical approach: drink enough water to maintain adequate hydration, pale yellow urine, no thirst, distribute intake throughout the day, use lukewarm water for cleansing, and if you have hard or highly chlorinated water concerns, consider filtering. Hydration is one component of comprehensive acne management but not a standalone cure. Guide 36: Gut Health, Microbiome, and Emerging Research on Gut-Skin Axis. Emerging research increasingly implicates gut health and microbiota composition in acne development. Understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. Acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal. Manage this by stopping all actives temporarily and using only gentle cleanser, hydrating moisturizer, and sunscreen for 1 to 2 weeks. Allow your skin barrier to repair. Then gradually reintroduce treatments at lower concentrations and frequencies. Building tolerance to treatments requires patience and gradual progression. Start conservatively and increase gradually. This approach takes longer initially but leads to better long-term outcomes than aggressive starting that causes severe side effects and treatment discontinuation. Remember that slow, consistent progress is preferable to fast progress interrupted by side effects forcing you to quit. Guide 19, The Complete Long-Term Acne Maintenance and Prevention Plan. Once you've achieved clear skin, the challenge becomes maintaining clarity. Many people achieve clear skin only to abandon their routines, resulting in acne recurrence. Understanding long-term maintenance prevents this cycle and keeps your skin clear indefinitely. Continue your core routine indefinitely. The Cleanse, Treat, Moisturize, Protect routine that cleared your acne remains essential for maintaining clear skin. Don't abandon these steps thinking they're only necessary while acne is active. Your skin's tendencies haven't changed. Stopping treatment allows acne to return. Identify which specific treatments worked for you and continue them. If salicylic acid was crucial to your success, continue using it at maintenance levels, perhaps 2 to 3 times weekly instead of daily. If retinoids were essential, continue them nightly or at whatever frequency you use successfully. If benzoyl peroxide was key, continue it. Maintenance doesn't require the aggressive frequency you may have used during active acne treatment, but it requires continuing the treatments that worked. Simplify your routine for maintenance if desired. During active acne treatment, you might use multiple actives, but once clear, you can often maintain clarity with fewer products. For example, you might maintain clear skin using just retinoid at night and benzoyl peroxide spot treatments as needed, dropping the salicylic acid cleanser you used initially. Experiment to find the minimum effective routine for your skin. Monitor your skin monthly for early signs of breakout. Catching pimples at the very first sign and treating them aggressively prevents them from developing fully. Many people can prevent significant breakouts through early intervention with spot treatments when they notice the first small bumps. Keep your skincare routine on hand. Never run out of your essential treatments. Having spare bottles ensures you never skip treatments due to product unavailability. Some people order backup products when their current product is half empty, ensuring continuity. Identify your acne triggers through your skincare journal. Did acne worsen during stressful periods? After consuming certain foods? During certain times of your menstrual cycle? After skipping your routine? After trying new products? Understanding your personal triggers allows you to implement preventative strategies. If you identify stress as a trigger, prioritize stress management. If certain foods worsen acne, avoid them. If hormonal cycling causes breakouts, prepare in advance with more aggressive treatment during high-risk times. Seasonal adjustments may be necessary. Some people experience worse acne in summer, increased heat, humidity, sun exposure, or winter, dry air, heating systems. Adjust your routine seasonally, perhaps more frequent use of oil control treatments in summer, more aggressive moisturizing in winter. This flexibility maintains clear skin year-round. Maintain the lifestyle habits that support clear skin. Continue stress management, adequate sleep, regular exercise, healthy diet, and hydration. Don't revert to poor habits thinking your clear skin is permanent and won't be affected. Lifestyle factors remain important indefinitely. Schedule regular dermatology visits even after achieving clear skin. Annual checkups allow your dermatologist to assess your maintenance routine, adjust treatment if necessary, and catch any skin concerns early. Regular professional oversight prevents complications and ensures your long-term skin health. Handle occasional breakouts strategically. Everyone experiences occasional breakouts despite perfect routines, a particularly stressful period, new product irritation, or unknown trigger can cause isolated pimples. Treat these immediately with appropriate spot treatments. Don't allow occasional breakouts to discourage you into abandoning your routine. If you notice increasing breakouts despite consistent routine, assess what has changed. New products? Increased stress? Dietary changes? Hormonal changes? Identifying changes allows you to troubleshoot. Sometimes a simple adjustment, returning to a previous moisturizer, increasing stress management, or addressing dietary changes, restores clarity. For women, track your menstrual cycle and acne patterns indefinitely. If hormonal patterns are evident, you can prepare in advance during high-risk times with more aggressive treatment or preventative actions. Update your routine periodically based on new information. Skincare science evolves, new evidence-based ingredients and treatments emerge. While your core routine remains consistent, you might incorporate new additions. For example, if you weren't using sunscreen consistently but learn about new photostable sunscreen formulations, adding a good sunscreen enhances your results. However, don't constantly change your routine chasing new trends. Consistency matters far more than having the newest products. Have a plan if major breakout recurs. If despite your best efforts you experience significant acne recurrence, don't panic or feel you've failed. Contact your dermatologist to identify what changed and resume professional treatment if necessary. Sometimes life circumstances, severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times? Severe acne involving all types? Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually requires systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. Start conservatively with treatments. Begin with a single action can also cause micro tears in your skin barrier, leading to increased sensitivity and irritation. For these reasons, dermatologists typically recommend avoiding physical scrubs if you have acne. Chemical exfoliation is gentler and more effective. There are two main types of chemical exfoliants: alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs. AHAs, including glycolic acid and lactic acid, are water-soluble and work on the skin's surface. They're excellent for general exfoliation, improving texture, and reducing the appearance of fine lines. However, they don't penetrate into oil-filled pores effectively. BHAs, particularly salicylic acid, are oil-soluble and can penetrate into sebum-filled pores, making them ideal for acne-prone skin. Salicylic acid dissolves the sebum and dead skin cell plug within the follicle, directly preventing and treating comedones. For acne-prone skin, exfoliating 2 to 3 times weekly with salicylic acid is generally appropriate. Some people with very resilient skin can tolerate daily use, while those with sensitive skin may do better with once or twice weekly exfoliation. Begin conservatively with 2 to 3 times weekly, observing how your skin responds over 2 to 3 weeks before increasing frequency. Exfoliation products come in various formats. Exfoliating cleansers contain salicylic acid and are used during your regular cleansing routine. These are gentle and convenient for daily use. Exfoliating toners are applied after cleansing and before other treatments. They're typically stronger than cleansers and are meant to be left on the skin. Exfoliating serums and treatments are the most concentrated forms and are usually applied 2 to 3 times weekly. Exfoliating masks are meant to be applied for a specific duration, usually 10 to 15 minutes, then rinsed off. When starting exfoliation, begin with a lower concentration of salicylic acid, typically 0.5% to 1%, and gradually work up to 2% as your skin builds tolerance. Many beginners make the mistake of jumping to high concentrations, causing excessive irritation, dryness, and peeling. This leads them to conclude that exfoliation doesn't work for them when the actual problem was starting too strong. The exfoliation process requires proper technique. Apply your exfoliating product to clean, completely dry skin. Applying to damp skin increases irritation and reduces effectiveness. Use your fingertips to apply the product gently, spreading it evenly across your face, paying special attention to areas where acne is most prevalent. Some exfoliating products are meant to be left on overnight, while others are rinsed off after a specific duration. Follow product instructions carefully. During the initial exfoliation period, expect some adjustment. Your skin may experience mild redness, slight dryness, or mild peeling. This is normal and typically subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, excessive peeling, or significant discomfort, reduce your exfoliation frequency or concentration. Listen to your skin, it will tell you what it needs. Never combine multiple exfoliating products on the same day, and especially avoid combining exfoliants with other strong actives like retinoids or benzoyl peroxide on the same night initially. This overexfoliation damages your skin barrier, causes excessive irritation, and can actually worsen acne. Once your skin is accustomed to each product individually, you can sometimes combine them, but do so cautiously and only if your skin tolerates it well. Some people experience purging when they begin exfoliation, where acne temporarily worsens as the exfoliant brings impurities to the skin surface. This is generally a positive sign that the product is working, and it usually subsides within 1 to 2 weeks. However, if purging lasts longer than 2 to 3 weeks or becomes unbearable, discontinue the product and consult a dermatologist. After exfoliating, your skin barrier is compromised and needs careful management. Moisturize generously with a product suitable for your skin type. Avoid other potentially irritating ingredients like vitamin C, niacinamide in high concentrations, or peptides on exfoliation days. Stick to basic cleanse, exfoliate, and moisturize. Use sunscreen religiously, as exfoliated skin is more susceptible to UV damage. Seasonal variations affect exfoliation needs. During winter, when skin is naturally drier, you may need to reduce exfoliation frequency. During summer, when skin is oilier and more resilient, you might tolerate more frequent exfoliation. Listen to your skin and adjust accordingly. Results from regular exfoliation appear gradually. After 4 weeks of consistent exfoliation with salicylic acid, you should notice smoother texture, fewer comedones, and generally improved skin clarity. Acne lesions should appear flatter and less inflamed. However, exfoliation is most effective as part of a comprehensive acne treatment plan, not as a standalone solution. Guide 4: Salicylic Acid, the Science, Concentrations, and Complete Application Guide. Salicylic acid has been a cornerstone of acne treatment for decades, and understanding its mechanism and proper use is essential for anyone dealing with acne. Salicylic acid is a beta-hydroxy acid, BHA, meaning it's oil-soluble. This oil solubility is what makes it particularly effective for acne-prone skin. It can penetrate into oil-filled pores where other water-soluble ingredients cannot reach. Salicylic acid works through multiple mechanisms. First, it acts as a keratolytic, meaning it helps dissolve the protein bonds between dead skin cells, promoting cell shedding. Inside the follicle, it dissolves the sebum and dead skin cell mixture that forms comedone plugs. Second, it has mild antibacterial properties, helping reduce bacterial colonization within blocked pores. Third, it has anti-inflammatory effects, reducing the redness and irritation associated with acne lesions. Fourth, it can stimulate cellular turnover, promoting healthier skin overall. Salicylic acid comes in various concentrations, typically ranging from 0.5% to 2%. The concentration directly correlates with effectiveness and also with irritation potential. A 0.5% solution is very gentle, making it suitable for sensitive skin or those new to salicylic acid. A 1% solution is considered standard for most people with acne-prone skin, providing a good balance between effectiveness and tolerability. A 2% solution is the maximum recommended concentration for at-home use, offering significant exfoliating power but requiring experienced use to avoid over-irritation. Professional-grade salicylic acid can be applied at concentrations up to 20 to 30% during chemical peels, but these are only performed in clinical settings and are significantly stronger than over-the-counter products. Salicylic acid products come in numerous formats, each with advantages and disadvantages. Cleansers containing 0.5 to 2% salicylic acid are the gentlest form. You use them daily during your regular cleansing routine, and the short contact time limits irritation while still providing exfoliating benefits. Cleansers are ideal for maintaining clear skin and for beginners new to salicylic acid. Toners or liquid exfoliants contain higher concentrations and are left on the skin, providing more potent exfoliation than cleansers. These are typically applied after cleansing and before other treatments, 2 to 3 times weekly. They provide more dramatic exfoliation than cleansers but also carry more irritation risk. Serums and treatments are concentrated salicylic oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, Potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible, though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines. Fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90. Acne and chronic illness. Managing acne while managing other conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91. Acne treatment and vaccination, timing and considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92. acne prevention in high-risk children and adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93, Acne in Performing Arts and Image-Dependent Professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94, Acne and Sleep Disorders, Managing Acne while Managing Sleep Issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretically including a niacinamide product in your routine might provide additional benefit alongside topical antifungals. The challenge with fungal acne is that it can recur if contributing factors aren't addressed. If you treat fungal acne successfully but then resume wearing tight synthetic clothing in a humid environment, fungal acne may recur. Long-term management might involve occasional use of topical antifungals, weekly or monthly, to prevent recurrence. If you've been treating acne without improvement for several weeks or months, ask your dermatologist about fungal acne. A simple KOH preparation takes minutes and can confirm or rule out malassezia. Don't waste time on ineffective antibacterial treatments if you have fungal acne. Appropriate antifungal treatment provides rapid improvement. Guide 25. Acne in different life stages: adolescent, adult, and menopausal acne. Acne presents differently and requires different approaches depending on life stage. Understanding age-specific acne characteristics and treatment approaches ensures appropriate management across different ages. Adolescent acne, occurring during puberty, is the most common form. Hormonal changes during puberty, particularly increased androgens, trigger increased sebum production, making adolescent acne typically more oily and comedone-prone. Adolescent acne often affects the T-zone, forehead, nose, chin, particularly heavily. Peer influence, stress about appearance, and psychological impact are often significant. Most adolescents can manage acne with topical treatments alone, though moderate to severe cases may require oral antibiotics or hormonal treatments, particularly girls. Treatment approach for adolescent acne emphasizes prevention and establishing good habits. Starting with gentle cleansing, topical treatments, and sun protection during teenage years establishes habits that persist into adulthood. Most adolescent acne improves or resolves as hormonal stability is achieved in late teens or early 20s, though some individuals continue experiencing acne into adulthood. Adult acne, occurring in adults beyond teenage years, has different characteristics. Adult acne is often more localized, jawline, chin, lower face, and frequently hormonal in nature, particularly in women. Adult acne is often more inflammatory than comedonal compared to adolescent acne. Stress, hormonal cycles, skincare product irritation, and lifestyle factors play larger roles in adult acne than in adolescent acne. Adult acne is sometimes attributed to skincare products or cosmetics, acne cosmetica. Adult women with acne often benefit from hormonal evaluation and hormonal treatments. Oral contraceptives or spironolactone can provide significant improvement. Additionally, adult women should evaluate whether acne patterns correlate with their menstrual cycle, as this suggests hormonal involvement. Adult male acne is less common than in adolescence but does occur. When it persists into adulthood, it's often quite severe and may warrant aggressive treatment including isotretinoin consideration if not responsive to standard treatments. Occupational factors sometimes contribute to adult acne. Individuals with occupations exposing them to oils, chemicals, or heat, mechanics, cooks, healthcare workers, sometimes experience acne from occupational exposure. In these cases, addressing occupational factors, protective equipment, skin cleansing protocols, helps alongside medical treatment. Menopausal acne occurs in perimenopausal and menopausal women due to hormonal fluctuations. As estrogen levels decline and the ratio of androgens to estrogen increases, acne can develop or worsen. Menopausal acne often presents as deep, cystic lesions on the lower face and chin. Hormone replacement therapy, HRT, during menopause can help manage menopausal acne, though it's a complex decision requiring discussion with your healthcare provider about overall health implications of HRT. If HRT isn't pursued, topical treatments and oral spironolactone are options for menopausal acne. Many menopausal women find that aggressive topical treatment with retinoids and benzoyl peroxide adequately controls acne. Stress management and lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large-area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between life stages sometimes occurs. A teenager transitioning to adulthood might experience changing acne patterns. An adult woman starting hormonal contraceptive might initially experience worsening acne before improvement. A woman entering perimenopause might experience acne worsening despite previous successful acne control. These transitions require reassessment and potential treatment adjustments. Psychological impact varies with age. Adolescent acne causes significant psychological distress due to developmental sensitivity about appearance and peer dynamics. Adult acne can cause depression and anxiety, particularly if unexpected after years of clear skin. Menopausal acne can be particularly frustrating as women are simultaneously managing other menopausal symptoms. Acknowledging the psychological impact and treating acne aggressively for mental health reasons is justified. Understanding your life stage allows you to set appropriate expectations and select appropriate treatments. Adolescents should prevent lifelong acne through good habits. Adults should identify contributing factors, stress, hormones, products, specific to their life circumstances. Menopausal women should recognize acne as a normal menopausal symptom and pursue appropriate treatment. Pregnant women should prioritize safety while still treating acne to maintain mental health. Postpartum women should understand that acne often resolves as hormones stabilize. Guide 26. Post-acne skin barrier repair and restoration after aggressive treatment. After intensive acne treatment, your skin barrier often requires dedicated repair and restoration. Understanding skin barrier function, signs of barrier compromise, and recovery strategies is essential for returning to healthy, resilient skin after aggressive treatment phases. Your skin barrier, also called the stratum corneum, consists of dead skin cells, corneocytes, bound together by lipids, creating a protective wall that prevents water loss and keeps irritants and pathogens out. When functioning optimally, your barrier is resilient, hydrated, and protective. When compromised by aggressive acne treatment, the barrier becomes insulin surges, triggering increased sebaceous gland activity and androgen production, both of which worsen acne. Foods with high glycemic index include white bread, white rice, sugary beverages, refined cereals, and most processed snacks. Replace these with low glycemic alternatives, whole grain bread, brown rice, vegetables, legumes, and nuts. This dietary shift reduces blood sugar volatility and decreases acne-triggering hormonal responses. Dairy products, particularly milk, contain hormones and bioactive peptides that may trigger acne in susceptible individuals. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains,